We'll be speaking to Dr. Dennis J. Halmi, a board-certified general surgeon who completed his residency at the Brooklyn Hospital Center in New York. Dr. Halmi has performed over 1,500 gastric bypass surgeries and over 100 laparoscopic gastric bands. He is one of the pioneers in the field of weight loss surgery and has contributed numerous research papers in this area. Once the surgery is complete, I'm sure there are a lot of things to consider with recovery and the comprehensive program of lifestyle change. Can you tell us about some of that?
Well, to start with the recovery, most patients spend 1 or 2 nights at the hospital after the surgery. Some of the patients who have lap band can go home the same day. Generally, between 1 and 2 weeks, most patients can return to work. And then they need to return for follow-ups every 1 to 2 months during the first year. This is the time when they need to make those changes, and we need to monitor their adjustment. So when they return, we will evaluate their weight loss, their diet, their nutrition, if they have any difficulties. We have nutritionists who monitor their intake of proper nutrients. We do periodic blood testing to monitor for to prevent any kind of nutritional deficiencies. We have exercise advice built in this program periodically, and we have psychological monitoring and help as needed.
Dr. Halmi, can you predict to some extent how much weight someone will lose after the surgery?
Generally speaking, after a band surgery, we expect patients to lose between 5 and 8 pounds a month. For the gastric bypass surgery, most patients lose 10 to 15 pounds a month.
How will the body and digestive system react to food after the surgery?
With the gastric bypass, there is a big change of how food will be digested. So those patients who had gastric bypass, they need to be very careful because there will be many foods that will not taste good or they will feel very heavy.
And what would those specific foods be?
Usually, fortunately, those are the foods that we try to avoid. So foods that have high fat content, carbs, sugars, those are the foods that most gastric bypass patients' stomachs will not be able to digest. So they will be sort of geared towards eating very light foods, mostly protein, vegetables, fruits, generally speaking, healthy diet.
What about liquids? Would a patient have to restrict those too?
Unfortunately, liquids, no matter how small we make the stomach or how narrow we make the channel, will pass through. So patients need to be very careful with any liquid calories, because that's one of the pitfalls of these surgeries where patients can fail. If they consume large amount of liquids that have high calorie, and alcohol is one of those things.
Today on Experts on Demand, we've been talking to Dr. Dennis J. Halmi of the Bluepoint Surgical Group with locations in Vienna and Woodbridge, Virginia. Thank you so much for joining us today, Dr. Halmi. You've given us a lot of very good information.